Hello, this is Angelia, and you are listening to or watching the podcast Why You Do What You Do, the podcast that talks about human development psychology to try and help you figure out maybe a little bit more about why you do what you do. And if you turn in on YouTube to my Bible reading and wisdoms, that's not gonna go on today. There were some technical difficulties. This looks like maybe there's still some technical difficulties, but I decided not to go back and redo that in the interest of time. I'll try it again tomorrow. So, you know, if you rely on me for that, then you're going to have to crack your own Bible open and maybe look up an inspirational quote or something today, because I just had to move on. But last time we were talking about bulimia nervosa, and it comes in different forms. It can be also a binge eating disorder. It doesn't have to just be where, you're starving and puking yourself, and we're going to take up on that again. Researchers in London, Sweden, and Germany have found reduced blood flow to certain parts of the brain in anorexics, including an area thought to control visual self-perception and appetite. So there could actually be a problem in the brain to where when they look at themselves, they think they're fat. And also they can have problems where they're not hungry or they're too hungry, so keep talking to them young people, and make sure they're in a good place, and have a good relationship with their food and their bodies, would be good too. Bulimia seems to be related to low levels of the brain chemical serotonin. And if you don't remember, serotonin is the chemical that has to do with kind of keeping you happy. So if you're depressed or anxious, you're going to have a lower amount of serotonin, and it can lead to weight and eating disorder problems. So again, if you notice the kiddos are, seeming depressed or more anxious than they should be, don't let there be a stigma about it. Take them to talk to somebody. Like I said, I've taken antidepressants and anti-anxiety meds. I was fine. They did their job, and within 6 months I was off of them. It's not a lifelong sentence. It doesn't have to be, especially if it's a situational thing. Like mine was the death of my mother, and then, the bad outcome of a hearing for disability where I was treated very badly and slandered. Within 6 months, I wasn't thinking about hurting myself anymore. I was getting out of bed, doing my thing. So, I said, I think I can get off these now. And the doctor said, okay, well, let's try. And I did, and, it was pretty good. So, I made it. But, don't let there be a stigma about, helping people, to get over this. There's no stigma there. Like I said, if you think your kid's possessed, you'll probably call a priest. If your kid is sick, you're going to take him to the doctor. So, if your teenager is having some mental and emotional problems, take them to a counselor or a psychotherapist. It's no different. Some psychologists see anorexia as related to fear of growing up, or fear of sexuality, or to a malfunctioning family. Now, I've heard the fear of growing up thing, and there's a lot more research that says the sexuality and the dysfunctional family plays more into it. And like I said, there's always exceptions to a rule, so I'm not going to say that never happens. It could be that. But they had done studies where children who have been molested are afraid of becoming sexual beings, because once they find out about sex and realize that something sexual was done to them they didn't understand because they were a child, then they're like, oh no, I don't want to do that. I don't want to be a grown person, you know. So this is not okay with me. And that can lead to eating disorders and problems like that. And again, if the family's in discord and the child feels insecure and is like, what's going to happen to me? Family's all goofed up. You know, do I even have a future? You know, so they're anxious and depressed. And they can't control the parents, so they can't control the situation. So they take control of what they can, which is how they eat, how they look. So, you know, keep an eye on your youngsters and make sure they're in a good place. People with bulimia are thought to use food to satisfy their hunger for love and attention. And that's true. I know women who, you know, didn't get the guy, started eating, you know, got big, got depressed, got bigger because they started eating more. And you need to tell your youngsters, nothing's ever going to fill that hole. You have to do that for yourself. Love, money, sex, food is not going to fill that hole. You have to do that for yourself. You have to find fulfillment in your life, and you have to learn to love yourself, because the love of another person is good. When you get that, it feels really good. But the number one person who needs to love you is you, because God already loves you. He sent his son to die for you, so that's already done. But you need to learn to love you. You need to accept yourself as you are, make good choices for yourself. And that's what you need to tell your young people, is that the most important love is the one you have for yourself. Because God's already got that. He already loves you. And you might not never find a person in the world that loves you the way you want to be loved. And you might end up in relationships that aren't fulfilling and that you leave. And, you know, it's not the end of the world. It feels like it in the moment. And tell them that too. It feels like your heart is broken, you can't go on, it's the end of the world. But it's not. As time goes on, you get over it. I hate to tell you that, but you do get over it. And you move on. And it's important to let young people know that, so that, you know, they're not always trying to fill that hole for love they might not have gotten in their family with something, you know, and in this case, food, or lack thereof. Excessive concern with body image, weight, and dieting can be an early warning sign, because usually that's a sign that something bigger is going on. The eating problems are a symptom of something bigger. Like I say, depression, anxiety, there's different mental illnesses that can come into play there. So that is a symptom that tells you something is going on. So don't ignore that. You know, if you see the kid eating too much, eating too little, that's when you say, what is going on with that? You know, why are you doing that? You know, and you'd be surprised that if you just ask, the kid will probably tell you. You know, because kids want help and they desire their parents to be involved, but they're not usually going to ask, because they know parents are busy, parents have lives. So usually they're just going to bottle this up inside until it spills out in some kind of way, you know, which could be eating disorder. So you got to be present for your youngsters. Anorexia and bulimia may be treated with behavioral therapy, followed by individual, group, or family psychotherapy. And I went to therapy in my 20s, and then again, you know, later on in the 40s, because I was having problems, and I knew enough to know, like I said, if you're sick, you go to the doctor. If you think something else is going on, you might call the priest. And if you're mentally and emotionally ill and you know it, and there's a problem, because you're just not getting your life right, and you need to talk to somebody, and you can come through anything that's happened to you. There's nothing that you can't come through, you know so now of course somebody's gonna say, oh, but maybe being hit by a Mack truck, you can't. Now come on, get real. You know what I'm saying. Get over it. Cognitive behavioral therapy, getting patients to rethink their attitudes, which is very helpful. I've done that too. Because sometimes, especially if you're a victim of horrible things, you kind of get in that victim mode. It's like, well, everyone does this to me. Everyone thinks this, and I'm just whatever. And they use me for this or whatever. And you start to believe that. And so in believing that, you start to cop an attitude with other people, and then you make a self-fulfilling prophecy. So that then that's how that works out. And sometimes it's your thinking that needs to change. Now, I've talked to some coaching clients about that before, and with mixed results. Because some people think their thinking is perfectly right, and everybody else is the mean, wrong, bad people. But the more horrific the trauma was, the more a person, has their outlook colored by this. So, there was the old saying of, back in the 70s and 80s, like, who hurt you when somebody was being a jerk? But it wasn't that far off, because when you're being that way, you're kind of telling other people something happened to me. Somebody hurt me, and this is why I'm acting like this towards you. So, if you need an adjustment, if you need an adjustment in your back, you might go to a chiropractor. But if you need an adjustment in your thinking, you should go to a therapist. Eating habits and self-defeating beliefs. Again, eating habits, like, I'm not even going to say, but I knew someone who used to come home from school and cook a pizza every day and eat this pizza after school. Needless to say, they were gaining some weight. I think there were some emotional issues there that they weren't talking about. But, that was kind of excessive for a snack to eat a whole frozen pizza. But some people believe they're unworthy. They believe that they're not good enough. They believe that they are inherently flawed. And when your kid starts talking like that or believing like that, you need to sit them down and have a talk with them. And like I said, there are so many parents who are not involved in their kids' lives. They just don't bother, and then these kids, are basically trying to struggle along the best they can. And adolescents are not adults. They're still illogical, impulsive, immature. So you need to be there for them, and you need to take notice of what's going on. You don't just be happy that they're in the room with the door closed, doing their own thing, doing their homework or whatever. So you need to keep an eye on things. Since these patients are at risk for depression and suicide, antidepressant drugs such as Prozac can be helpful when combined with psychotherapy, and yes, it can. The outlook for people with bulimia is better than for those with anorexia, because the patients generally want treatment. Because the ones with anorexia, they're dead set on looking this way, being this way. Well, the ones with bulimia are more likely to say, yeah, I have a problem. I feel bad about myself. I eat. I feel like I ate too much. I go throw it up. Then I skip meals, and then I go pig out because I'm hungry. I need help. They realize that this is out of control. Whereas anorexics might say, I have to weigh 100 pounds. 98 would be better. Well, now that I'm 98, 95 would be better. and they have a skewed perception. If, you know, they look at themselves and you're seeing a little bony person, they see this one little chunk of flesh on their hip and think they're fat. So it's a problem. Researchers have found an average recovery rate of 50% after periods ranging from 6 months to 5 years in patients treated for bulimia. So, bulimics have a better recovery rate. About half of them will recover. It's just all about developing a healthy relationship with yourself and your food and your body, because it's what you got to keep you going for the rest of this life. So you're going to have to take care of it. People with anorexia often have long-term psychological problems even after they have stopped starving themselves. And they've done some studies on this, and there was a girl that they had on TV, and they interviewed her after her anorexia and things, and she still had self-esteem issues. So it's harder to overcome anorexia. And like I said, if you start seeing this happen, step in. And if no one stepped in for you, I'm sorry that happened to you. And if I'd been your mom, I'd have stepped in for you. But you just gotta keep your eyes on these little folks. You just do. Up to 25% of patients with anorexia progress to chronic invalidism, and between 2 to 10% die prematurely. And invalidism, where they are basically think they're nothing, and they invalidate themselves. They invalidate everything everyone says to them because they're so dead set, usually on being dead, and their choice is to starve themselves to death. So it's not a good outcome for people with anorexia. Use and abuse of drugs. Use of illicit drugs among U.S. adolescents have declined slightly overall since its recent high levels in 1996 and 97, and is well below the peak during the late 70s and early 80s. So in the 70s and 80s, I think we all know there was a lot of experimentation with some illicit substances. If you're around my age, what was going on at the bus stop and after school. The upsurge during the early 90s accompanied a decline in perception of the dangers of drug use and a softening of peer disapproval. So in the 90s, it became more socially acceptable to do these drugs. And other kids weren't saying, oh, you shouldn't do that, They were just kind of meh. But the trend has now begun to reverse itself, including for the first time a drop in use of crack cocaine. Because there for a while in the late 90s, 2000s and things, that was the drug of choice. You could go out and find someone who had that. And then of course in the mid 2000s it became meth. People was cooking up meth. There was a guy about 3 streets down from where I live cooking meth in his garage and blew his garage up, caught it on fire. So it's everywhere, and even good families can have problems with drugs. 2 exceptions to the general trend have been increased use of MDMA, or it's called ecstasy, a hallucinatory club drug popular at night-long raves, and of anabolic steroids to enhance music. Good gosh, now I got music in the brain. And to enhance muscle strength among 10th grade boys. And they did a study, and that was where mostly the boys started thinking about steroids. Was their second year of high school, when they had a chance to go from like JV to varsity in the sports programs. They wanted that muscle. They wanted to be bigger, especially if they perceive themselves as not being muscular enough. So that's when the steroid use started kicking with these young men. And you need to talk to your young men if you notice they're starting to get a little beefy. You can even say, make sure you don't do those. I mean, I don't know if young people nowadays, they might because of the Super Bowl commercial now, but if they knew who Arnold Schwarzenegger was and that he ended up with a hole in his heart, probably from doing steroids, don't quote me on that, and if that's wrong, Arnold, sorry, but you know, it's not worth it. It's not worth it. And look at all your guys in the baseball who got their records kicked out because it was found they were doing steroids. It's just not worth it. So, if your young man seems to be getting beefy, you might want to say, hey, are you working out more? You're not taking steroids, or because that stuff can kill you. I don't want you doing it. And kids will listen to you. They might not take your advice. They might not do what you want, but they will listen to you. However, oh my, ecstasy use declined in the early 2000s. So it was a big deal, and people were doing ecstasy, and then people started lacing it with fentanyl and crazy stuff, and so they were like, oh, okay, well, we're going to stop doing this too, because it wasn't worth it. You can have fun. You can go out to a club and have a lot of fun without even drinking any alcohol. I go out to a club with friends, listen to music. I drink a Shirley Temple. No alcohol. It looks just like a drink. And it tastes better than a drink, if you ask me, because, alcohol's burn and nasty. But, you can have fun without doing drugs or alcohol. Amazingly enough, you can. You can just enjoy your time. These findings come from the latest in a series of annual government surveys of a nationally representative sample of more than 43,000 8th, 10th, and 12th graders in 394 schools across the United States. So, that's a pretty good sampling. These surveys probably underestimate adolescent drug use since they do not reach high school dropouts who are likely to have higher rates. And let's face the facts, there's going to be some kids who are not going to tell the truth on a survey. Just in case, it might make its way back to mom or pop. Risk factors for drug abuse. What makes it likely that a particular young person will abuse drugs? Well, it could be a lot of reasons. Research has pinpointed a number of risk factors. Number 1, poor impulse control. And that's a problem for kids with ADD, ADHD, and some other, problems. And they have a hard time not doing what they decide they want to do. So again, if you have children who are in these groups, you might want to have a special talk with them and say, I know so-and-so's probably doing this, your buddies are, but I don't want you doing it. Just say no. Just because someone else does something doesn't mean you should be doing something. I expect more from you. And a tendency to seek out sensation, which may have a biochemical basis. Again, like I said, if they're kind of numb to life, there's thrill seekers. There's people who need that and want that, and some of them turn to drugs. Family influences, such as genetic predisposition to alcoholism, and that is something that runs in my family, and that's what I told my kids. I just prefer you not get drunk. I prefer you don't, because alcoholism runs in our families. We had 2 uncles and a cousin who died from alcoholism. I just assume you not get drunk, because I don't want that to happen to you. I don't want to have to go to your funeral and bury you because you drank yourself to death, because I love you and I don't want to see that happen to you. And that's pretty much usually all you got to do. Parental use or acceptance of drugs, and there are some parents, I know some people who did drugs and were perfectly okay with their children and even their grandchildren doing drugs. Now, to me, that tells me you're not the kind of human being I want to be around. And as long as you have people like that and the parents are okay with this, what chance does a kid have? Because the children's going to learn what they live. And if they're living with drugs, they're going to learn that, and that's a possibility that that's what they're going to be doing. So, those are the kids I feel sorry for. Poor or inconsistent parenting practices, like again, if the parent's not involved or they're not involved on a regular basis, the kid's more vulnerable to peer pressure. Family conflict, again, if the parents are fighting and, dad goes off for a few days or mom takes off or whatever, these kids aren't being supervised like they should and they're more vulnerable. And troubled or distant family relationships. Again, if parents aren't communicating with them, they don't get along, they're not going to listen to anything that the parent says, or if the parent bothers to say anything. Difficult temperament. Now, if you remember the difficult child, we talked about that earlier on, and it says it in parentheses, difficult child, because as we learned, difficult children aren't difficult. The problem is the parents aren't mature enough to raise this child. The child asking constant questions, which is what kids do, because they're born not knowing anything. Your kid doesn't know anything when it's first born and when it's little. So it's going to ask you constant questions. So when the kid's asking you constant questions, they're not being a pain in the butt or whatever. They want to know. So, if the child was labeled difficult because the parents were not mature enough to be raising the child at that point, these children already feel bad about themselves because the parents have already dumped their garbage on them. You're a problem. You're tough. You're a pain in the butt. Blah, blah, blah. So now the kid doesn't think they're great anyway, so why not do the drugs? Why not try them out? The other kids are doing it. They don't like me anyway. Who cares? So, that's a problem. Early and persistent behavior problems. Again, some kids just have mental illnesses, mental disabilities, and they go these routes. That's why I say pay attention, and the earliest you see problems, early intervention can help. Particularly aggression. Aggressive kids are more likely to do the drugs. They're already aggressive, fighting or whatever. It's like, might as well. Academic failure and lack of commitment to education, because that produces low self-esteem. They feel like, I'm a failure anyway, might as well do the drugs. Peer rejection. Again, if they don't have any friends, and these people doing the drugs come and say, hey, you can hang out with us, you want to smoke this, you want to, shoot this or whatever, they're more likely to fall in with those people if they don't have, good friends who are, going to be there for them. Associating with drug users. Again, children learn what they live. If they're seeing it, they're more likely to do it. Alienation and rebelliousness. If you've alienated a child, make them feel like they're nothing, that's how they feel, like they're nothing. And, they're going to rebel against that because inherently they know that they're not nothing. But because you've been telling them this their whole childhood, they internalize that and they're like, oh, well, they don't like me anyway. Might as well do the drugs. So, favorable attitudes towards drug use. So some people think drug use is cool. It's okay. And if they decide this, there's not really a lot you can do to talk them out of it. And that's why you need early intervention to say, we don't want you doing drugs. They're dangerous. You don't know what you're getting. You could die from it. And 10, early initiation into drug use. The younger you are when you start, the more you're going to use and the harder it is to stop. So like I said, you need to be vigilant, and as soon as you know, you need to step in and say, no, this is not okay. We ain't okay with this. The more risk factors that are present, the greater the chance that an adolescent or young adult will abuse drugs. So the more problems they're having in their life, the less they feel like they are accepted and belong, the more likely it is that they're going to abuse drugs. Drug use often begins as children move from elementary school to middle school, because, a lot of elementary kids aren't doing drugs, but more kids in middle school are. And that peer pressure is a big deal. Remember we talked about in the middle school years. That's where they're looking to be popular, looking to have friends. And if they get in with people who think drug use is cool, they're more likely to do it. Where they meet new friends and become more vulnerable to peer pressure, like I just said. 4th to 6th graders may start using cigarettes, beer, and inhalants, and as they get older, move on to marijuana or harder drugs. So, that's crazy to think that like your 5th grader might start, doing drugs, but it is. And the problem is supervision. If these kids are out running the streets and going to other kids' house where they have the inhalants or, the pills or the marijuana, then they're exposed to them. And, I know there are people who they work late, they allow the kid to come home and just go to so-and-so's house, do whatever they want. But, yeah, you don't always know that. Whether they are, what they're doing. And I know older kids don't like to be put in daycare situations, but there are after-school programs, and you can come pick them up after you get off work at these after-school programs. There are sports and things like this. So if you can get your kid interested in that, that's a better option than allowing them to run the streets until you get home in an hour or two, because that's when nobody's watching is when stuff happens, because children got that Lord of the Flies mentality, and if you ain't there to supervise, they're going to do pretty much what they want to do. The earlier young people start using a drug, the more frequently they are likely to use it, and the greater the tendency to abuse it, because that's what it turns into. It starts out as getting high, and then it turns into an escape, and then they start to need that. Their body starts to crave that fix, and so then it becomes abuse. And I mean, there was this guy that I was talking to, and he said he was doing drugs, 4 to 6 times a day, as much as he could get a hold of. He ended up, of course, losing his family, losing his job. He was going, to the methadone clinic to get through work, because he decided, I'm losing everything. I got to quit doing this. And luckily he was able to do that, but it cost him a lot before he could. And unfortunately, not everybody is able to get off of drugs. Not everybody is. And unfortunately, a lot of our young people, they get involved in this stuff, and it's really unfortunate what can happen. And that's where I'm going to leave you today. Please like and share this educational program so we can spread it around the world. If you want to help me out, you can subscribe to my YouTube channel. If you'd like to help me out even more, you can go on my Patreon page and become a patron. I hope this has helped you figure out maybe a little bit more about why you do what you do. And that's all until next time.